Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to discuss why are so many Black women dying in childbirth. Let me start with a truth that is difficult to hear. In the United States, one of the wealthiest nations in the world, Black women are significantly more likely to die from pregnancy related complications than white women. Not in the 1800s, not before modern medicine. Now, according to the Centers for Disease Control and Prevention, Black women are roughly 3 times more likely to die from pregnancy related causes than white women. And what makes this even more alarming is this gap exists across income levels, across education levels, across celebrity status. Wealth does not protect Black mothers from this risk. So the question is not what's wrong with Black women. The question is what's wrong with the system meant to care for them. It's not biology, it's bias. There is no genetic explanation for this disparity. What research increasingly points to is systemic bias and the cumulative stress of racism itself. Studies from places like Harvard Medical School have explored how chronic stress from racial discrimination can increase risks for conditions like preeclampsia and hypertension, two leading causes of maternal death. But stress alone doesn't explain why women show up to hospitals asking for help and aren't heard. Black women report being dismissed when they say they're in pain, ignored when they describe symptoms, sent home when something feels wrong. And in childbirth, hours matter. The Serena Williams effect. When tennis champion Serena Williams gave birth, she experienced shortness of breath, a symptom she recognized as a blood clot due to her medical history. She told the medical team what was happening. She was initially dismissed. Let that sink in. One of the most famous athletes in the world, a woman with resources, access, and knowledge, had to fight to be believed. Now imagine the experience of a woman without that platform. The data behind the crisis. The American College of Obstetricians and Gynecologists acknowledges that systemic racism, not race itself, drives much of this disparity. The leading causes of maternal death include hemorrhage, cardiovascular conditions, infection, preeclampsia. Many of these are preventable. Many are treatable. Many are missed. And here's the most painful part: a significant percentage of pregnancy related deaths are considered preventable with timely, appropriate care. Preventable. The role of implicit bias. Implicit bias isn't about overt hatred, it's about subconscious assumptions. Research has shown that some healthcare providers underestimate Black patients' pain. Others may assume noncompliance or exaggeration of symptoms. When those assumptions enter the delivery room, they become dangerous. Because childbirth is unpredictable, it requires vigilance, it requires listening. When a mother says something isn't right, the correct response is not skepticism, it's action. Beyond the hospital, structural barriers. The gap doesn't begin in the delivery room. Black women are more likely to live in areas with hospital closures, have limited access to prenatal care, experience insurance gaps, encounter transportation barriers. In many states, maternity care deserts disproportionately affect communities of color. And postpartum care, the weeks after birth, when many complications occur, is often fragmented or inaccessible. Maternal mortality isn't just about labor, it's about the entire continuum of care. So, what needs to change? If the problem is systemic, the solution must be systemic too. 1. Mandatory bias training that goes beyond a checkbox. Healthcare systems must implement ongoing, evidence based bias and structural competency training, not one time seminars. 2. Invest in community based care. Studies show that doula support improves outcomes. Expanding access to midwives and culturally concordant care providers can reduce complications and improve trust. 3. Standardize emergency protocols. Hospitals that implement clear maternal safety bundles, step by step emergency response protocols, see reduced mortality rates. When care is standardized, bias has less room to operate. 4. Expand postpartum coverage. Extending Medicaid coverage to a full year postpartum is critical. Many deaths occur weeks or months after delivery. 5. Listen to Black women. This may sound simple, it is not. Listening requires humility, it requires believing, it requires shifting power, a moral and public health imperative. This crisis is not inevitable. Other high income countries have far lower maternal mortality rates. The United States has the medical knowledge, the technology, the resources. What we lack is equity in how those resources are distributed and delivered. And here's what's important: when we close gaps for those at highest risk, outcomes improve for everyone. Safer hospitals help all mothers. Clearer protocols protect all families. Expanded coverage strengthens entire communities. Equity is not a zero sum game. A vision forward. Imagine a healthcare system where every pregnant woman, regardless of race, zip code, or income, is treated with urgency, dignity, and respect. Where no mother has to advocate for her life while in labor. Where postpartum care is not optional. Where survival is the expectation, not the exception. Black maternal mortality is not just a statistic, it is daughters without mothers, partners without wives, children without parents. We know the causes, we know many of the solutions. The question is no longer, why is this happening? The question is, are we willing to change it? Thank you.